everyone. Welcome to this edition of Laser Veda, where we will bust some myths about dental bleaching, laser teeth whitening, or whitening as we popularly call it. First and foremost thing, who can undergo teeth whitening? Everyone. Everyone wants to look good. Nobody likes yellow, everybody likes white. So whether it's a kid, whether it's a teenager, whether it's an adult, or whether it's a geriatric patient, everyone deserves to look good. Everyone deserves to have a beautiful smile. So teeth whitening is no exception to this. So anyone at any age group should and can safely undergo teeth whitening. Why is it so that teeth whitening has always been shrouded with this mystery that it is invasive, it is painful, it causes a lot of sensitivity, it destroys enamel? Why is it so? It has been traditionally observed that the teeth whitening market has been dominated by hydrogen peroxide or carbamide peroxide based products. The problem with these hydrogen peroxide based products is that they are extremely harmful to the natural tissues. They are harmful to the soft tissues of the oral cavity, which are very sensitive, and at the same time they destroy a layer of the human enamel, and that's the reason why after the procedure of whitening the patient usually complains of extreme amounts of sensitivity. What are the recent advances in teeth whitening? The teeth whitening industry has been taken by storm with the introduction of organic whitening agents. What do I mean by organic whitening agents? We have finally bid adieu to the peroxide based whitening agents, and today we have got non-peroxide alternatives to the whitening products that we were using previously. So what are the advantages? The advantages of non-peroxide based whitening agents are that they are extremely gentle on the oral tissues. What do I mean by that? We do not have to use a soft tissue barrier or a gingival barrier for using these non-peroxide based products. They are extremely safe on the enamel. They do not cause sensitivity. They can be used in children. They can be used in adults. They can be used with a laser. They can be used without a laser. They can be used with a tray, without a tray. They can be used in the dental office. They can be used at home by the patient. So basically, non-peroxide based whitening agents are more versatile. So what are the active ingredients that are there in a non-peroxide whitening agent? We are talking today about thalidoperoxycaproic acid, which is an organic teeth whitener. This works on the principle of oxidation. Basically, when we talk about whitening, we need an agent to oxidize the carbon-to-carbon double bonds so that these double bond moieties are broken down into smaller single bond moieties, which will reflect more light, giving the perception of the teeth being whiter. So this is done by thalidoperoxycaproic acid, PAP as we popularly call it. What is this whole concept about the gold bleach? The gold bleach is a revolutionary concept that has been brought to India by Novolase Technologies, wherein 24K gold nanoparticles have been infused in the PAP mixture. Brilliant, isn't it? Why do I say so? If you look at the periodic table, let's say we locate gold Au, as in Latin called aurum. It has an atomic number of 79, and you can see here in the periodic table that it's a precious metal which is grouped in 11, group 11 and period 6 of the periodic table. What does that mean? That means that gold nanoparticles, going by its chemistry, have an inherent tendency or capacity to absorb near infrared light. That's exactly what we offer when we use an 810 nanometer laser to activate it. It can also, to some extent, absorb the blue light. So any of you who do not have an option of using a near infrared 810, you can probably try using the blue wavelength. So what is the procedure? The procedure is extremely simple. The patient is made to sit on the dental chair, and the gold gel is directly applied to dry enamel. It's always better if it has been prophylactically cleaned before the procedure, and there is no gingival barrier involved. So you just dispense the 24K Novolase gel onto the patient's enamel and you activate that by using the teeth whitening prism that comes with the unit, and it takes hardly 4 minutes of activation time, and after it is activated it will be left to oxidize for 15 minutes. So typically it will take 2 cycles of 15 minutes each, and in 30 minutes we are done with the procedure. What are the aftercare instructions? Advise the patient not to have any colored foods like rasam or maybe red wine, or if it's a patient who's used to tobacco, well, after 6 months the patient may need a touch-up, it may need a booster of sorts, and they can do that with the same gold gel either at home, or they can visit the dental office again for a touch-up with the gold bleach. If any patient is suffering from halitosis, bad breath, this is the best option for a 360-degree oral detox and fresh breath therapy along with teeth whitening. Are there any contraindications to this? Nothing actually. Till date, we do not have a single incidence of any allergy to the 24K gold gel that is used for the bleaching. So it's absolutely safe, can be used in diabetics, can be used in kids, it can be used in teenagers, it can be used at any age group. So that's about laser teeth whitening and the advantages and the disadvantages. So I hope you've had a good time listening to this, and I definitely urge you to undergo that 360 degrees oral detox if you are a patient, and if you are a dental surgeon, I sincerely urge you to start offering this option for your patients because they need it. Thank you.